Hi friends, I am Dr. B.B. Rao of Usha Clinic and founder of the websites qmedicaldoubts.blogspot.in and raghavamedicaldoubts.com. Through these videos, I am providing the basic knowledge about the commonly occurring diseases, treatment and surgery details where necessary for the medical knowledge to general people and for reference to medicos. Today I am going to discuss about the psychoneurosis and anxiety neurosis. Psychological problems are so prominent in the society that many of the problems are left unattended. In the milder form, most of the problems are treated by the general physicians. The psychiatry deals with the three large groups: major disorder, minor disorder, and the mental retardation. The major psychiatric illness of psychosis interfere with the patient's thinking, perception, feeling so profoundly that at times what he says to his neighbors no longer makes sense to them and is regarded as insane. Minor disorder. This group deals with patients with less gross disorders who remain in touch their surroundings. They suffer from psychoneurosis, personality disorders, psychosomatic illnesses, sexual deviation, and addiction. Mental retardation. Mental subnormality is a congenital condition, may start from birth or early age, unlike other forms. Classification. In brief, they are divided into two groups: organic and functional. Organic psychosis. In organic brain syndromes, functioning of the brain is impaired, maybe by physical lesions like trauma, tumor, infection, toxic effects, or degenerative process. Delirium. The organic brain syndromes, when acute, are known as delirium. For example, toxic confusional states occurring with brain trauma, cerebral anoxia, infection, or intoxication with barbiturates, amphetamines, or alcohol. Dementia. The chronic psychosis where an irreversible brain lesion has occurred are called dementia. The most common are ones associated with advancing age, atherosclerosis, and senile psychosis. Mild dementia. The patient is forgetful, easily confused, irritable, and emotional. More severe dementia causes disorientation, gross loss of memory, and deterioration in personal habits. Functional psychosis. These are the major psychiatric illnesses occurring without brain disease or impairment, which so far have eluded all attempts at explanation in terms of physical or biochemical pathology. The most common forms are the manic depressive psychosis. The principal symptom is a profound disturbance of the patient's mood and schizophrenia. The patient's thoughts become bizarre and strange, so that he loses contact with fellows and surroundings. Psychoneurosis. Psychoneurosis. There are three types: anxiety neurosis, hysterical neurosis, and a less common obsessive compulsive neurosis. Anxiety neurosis. Anxiety may be defined as a state of anticipation of something unpleasant about to happen, accompanied by feeling of tension, tense muscles, sweating, tremor, and tachycardia. Anxiety is a symptom of many psychological disorders. In anxiety neurosis, it dominates the picture, and other symptoms are minor features of the total illness. It is the most common feature of psychoneurosis. Etiology. Hereditary factor confirmed by the presence in family members, emotionally disturbing experiences in the early age, prolonged insecurity from the parents. Clinical features. The illness may be an acute anxiety state, often severe in intensity against a relatively normal background. A chronic anxiety state since adolescence in mild degree with periodic exacerbation depending on the tides of life. Feeling of tension and unpleasant anticipation. A phobia develops towards activity like traveling and may avoid it. There is a fluctuation of intensity like mild or panic and terror, but patient could not explain it. This state of anxiety gives rise to impaired power of concentration and decision making. Continuous state of restlessness of varying degree. There may be extreme irritability, fear of insanity, or suicidal tendency. Preoccupation of bodily functions and fear of serious illness. Continuous feeling of stress and exhaustion and lack of energy. Somatic symptoms are also prominent. There is tense musculature of fingers and hands, doing screwing if kerchief or twining of fingers, fine tremor of fingers and profuse sweating of forehead and palm. Pulse rate is raised and blood pressure is labile. Frequently of micturition, stools, nausea, fluctuance, poor appetite and loss of weight. Rapid breathing, tension type of headache and dizzy or frequent. Patient sleeps badly, wake up with difficulty, easily disturbed. There may be menstrual disturbances. Diagnosis. Keen history and examination to exclude the systemic diseases. Treatment. The patient needs an opportunity for exploration and clarification and for gaining greater insight into the nature of his difficulties. The physical factors like anemia, deficiencies, etc. may be corrected. The drugs to obtain the reduction of distressing mood disturbances often a necessary preliminary to psychotherapy. For very anxious patients, diazepam and chlordiazepoxide are effective. The phenothiazines and thioridazine can be of value, not for self-treatment due to side effects. Behavior therapy is a form of psychological deconditioning or desensitization, often effective when single disabling phobia as agoraphobia, fear of open space constitute the clinical picture. Exploratory psychotherapy. It calls on the patient to take the stock of his relationship with people close to him and to modify some of his habitual patterns of behavior towards them. Can also aim to relieve the depressive symptoms without attempting to effect any radical change in his personality. That's all about the anxiety neurosis, and in the next video I will discuss about some other disease. Thank you.